everyone. This is hair's looking a little crazy. This is Emily. I'm one of the co-founders of MedVenture app. We are going to have a really cool session with the co-founders of Kamana Health, and they're going to tell us some really cool, interesting things about how to stop repeating yourself to recruiters. So I'm just going to bring them on. Okay, let's do this. There we go. Cool. Oh, it works. Yay. Cool. Thanks for jumping on, guys. I'm also going to probably bring Ryan up as well.
Awesome.
Right.
Yeah. Thanks for having us, Emily.
And we're both vaccinated, otherwise we wouldn't be this close to each other.
Just put a little plug out there. Everyone get your vaccinations.
Yeah. We're vaccinated. Haven't sat this close to each other since the pandemic.
Awesome. Cool. So why don't you guys give us a little intro as far as like who you guys are and a little bit about Kamana.
Yeah, for sure. I'll go first. So
Yeah, sure.
I'm John. Hi, everybody. I'm one of the co-founders over at Kamana. I spent about 10 years in healthcare. I started as a paramedic and spent the majority of my career as a traveling nurse. I worked ER for the most part, some peds, but traveled all over like many of you. And through that, dealt with a lot. Like it really sucks onboarding with staffing agencies. Like a lot of travelers, I didn't just work with one. I worked with lots, and I was always open to potential opportunities with their staffing agencies. It's just constantly having to like maintain profiles with all these different companies, and I'm having to text and email my sensitive information. Like my data got hacked at one point, and then just like personally as a nurse, like felt like a good ER nurse, but felt like I really just was not good at keeping track of all of my medical history items and ACLS and PALS and all my certs, and then I had licenses in different states. So Dave and I have been longtime buddies, and kind of honestly, he was up in Anchorage with me. We were on a travel contract, and him and his partner came up there to kick it with me, and he was just kind of looking at me fumbling through this process and was like, hey man, there's got to be like an app or something out there to make this easier. And we talked to other travelers, and it wasn't there, it didn't exist. So we took off to start Kamana, and that was in 2018 when we started talking about all this. But yeah, it's been super exciting. Why don't you tell them about you, Dave?
Yeah, sure. I don't have a ton to add. I'm not a nurse or not a healthcare professional, but came from the healthcare world and in the hospital world of implementing EHRs. So I understand the pain point many of you have gone through and learning new software inside of the hospital. I used to have to teach it, so I know where you're at there. And nothing else that John didn't say other than I was a long-term friend of his, and was brainstorming really as many of you do, I'm sure, on the things that you like and don't like on travel nursing, and this was a pain point that was real for him and many of his travel nurse and healthcare professional coworkers, and we decided to go after it.
Awesome. Now you guys are super big with data privacy. So why does that matter, especially as healthcare professionals? Because I had never thought about it until I met you guys.
Yeah. So, no, I didn't think about it either until I got a letter in the mail one day, and a staffing agency that I actually didn't even work for. I just started the onboarding process with them, and the contract ended up closing. They got their email hacked, and when these hackers got in, they got all of the data, like all these other travel nurses, social security cards and tax home address and medical history items and all this stuff. So they send you a letter, and they like pay for like some credit monitoring thing, but it like sucked, and I was mad, right? But I'm better because I would never. Like we know not to just use Gmail and say, hey, Emily, I'm going to transfer a patient to your ICU. I'm going to email you. No, you would lose your job. So the same thing, that same respect with our own data. Like this is a remote relationship with staffing agencies. So when they need our stuff, this is sensitive information. We need to make sure that we're secure with how we share it. And on a just more privacy standpoint, we need to think about where we're putting our contact information, because there's just a lot of gross players in our market that they don't have a number if you give it to them. If you don't answer, they're going to share it with others, and it's going to get sold, and it's really hard to step away from that, as a lot of us have learned the hard way. But that's why it matters to us on a personal level, for sure.
So then, as healthcare professionals, is there a way for us when we're talking to different agencies to tell them explicitly, like, don't sell my information, or like, how do we go about that?
Yeah, so staffing agencies typically aren't the ones that are going to do that, because they don't want to share that with their potential competitors. It's more just paying attention to the different companies out there. There's lots of, like, we would call them like a lead generator, different companies that are like, sign up and you'll connect with the top staffing agencies. And it's kind of a rookie mistake, but that model, they're taking it and they're just selling your information, because you're valuable. You are a nurse that's interested in travel. You're a healthcare professional that's interested in taking a contract. They're going to share that information off of that. So pay attention to the company. Open up the terms of service. What do they do with your data? Look at their privacy policies. And then when you're talking with staffing agencies, make sure that they're not going to be blind submitting you. Make sure that you're using secure ways to share that information with them, so that if they get compromised in some way, ideally your stuff is locked away.
Mm-hmm. Right on. And then, so with these lead generations, they're essentially like gathering all this data and then selling it to the agencies. And then are the agencies reaching out to travelers? Is that how it works?
Yep. That's exactly it. They smile and dial when they get that. we're the market away from that. The more progressive staffing agencies are seeing that those tactics aren't as successful with connecting, but it's still absolutely a thing, unfortunately.
Okay. So then, in terms of like when you're emailing, then how important is it in terms of like protecting your data that way? Like, let's say someone's like, oh, you're filling out all this information and you're giving them your social security number. Like, what should we be aware of in that like data transfer?
Yeah, I'll take that one. That's a great question. And from our perspective, I mean, the answer is really short. Like, don't email yourself ever. Where email is really loose in terms of, you send something over here, and if you're sending it from one platform to a different platform, you don't know what could be intercepted from a security perspective in that transfer. And more importantly, like an email is only as secure as a single password is secure. It's only as secure as the human using it. And if you've got tens of thousands of health, like sending their sensitive information to like onboarding at staffingagency.com, that is just like a gold mine for like once, no way to so it's like you send it, it's there, and there's no way to get rid of it. And we created this like really cool concept in Kamano where a health professional can sign up and create this like unique link. And for folks that are savvy out there using like Dropbox or Google Drive to securely share their stuff, like that's a great path to take. And we've created this path for a healthcare professional to upload all the licenses and certifications and medical docs and social security card and driver's license and all these sensitive things that you exchange with staffing agencies, and create a secure link where if Emily is a recruiter and Emily wants to work with me, or Emily's a compliance manager and wants to work with me, then I can create this link that only Emily can access. And as soon as like Emily doesn't need that anymore, I just turn it off. So that way, if the link is sent via email, which is one way to send it, there's a couple ways. You can copy it, you can text it, you can email it. But if it's sent via email, like, and somebody does get a hold of that email address, you would have turned that link off and your information is no longer accessible.
Got it. So with your guys' platform, I'm familiar with it, but can you just explain it to everyone in terms of like, this is the best way to, or one of the ways to safely store and manage like all your credentials and everything?
Yeah, sure. So I'll talk about it from just the healthcare professional side. Like, as a nurse, like, I'm not the most like office admin savvy. So like Dave, and you meet those travelers out there that they're like, man, I got an Excel sheet and I track all my expirations and I'm using Dropbox and I think that's awesome. I'm not that kind of nurse, and I definitely don't have like a scanner at the house and like a printer and things like that. So where Kamana fits well for me as a traveler is it gives me that. It's a digital profile, it's a digital wallet, so I can upload the things I want to upload into it. If I'm out there looking for jobs, I'm doing things that are going to be part of my professional portfolio. So, I'm an ER nurse, I've got my PALS, my ACLS, my BLS, my different state licenses. I can build out my work history and generate a resume if I want to. I can upload my medical history items so I don't have them scattered, paper folders, things like that. All my mass fits and titers and immunization series, etc. Kind of have it all stored in one spot. And then I get reminders on when stuff's expiring. So if you don't even share this information, it's a great way just to keep your stuff centralized in one spot. And then as we all know, you're in that hospital, and even though they already have your stuff, somebody up in employee health is like, hey, we don't have a flu vaccine on file for you. And you're like, well, I don't know where the heck my flu vaccine piece of paper is. Well, with this, it's a secure way you can share it with that person. But then if you are in the market and you're looking for jobs, like through some of the workflows that Dave described, it gives you just an efficient way to share it with the recruiter. You can kind of give them an overview, which is like a de-identified, secure view of exactly who I am as a nurse, what certs I have, but I'm not going to give you my reference contact information because I'm not ready for you to call them. I'm not going to give you their security number, my tax home address, etc. And then if that recruiter comes back and they've got a legit contract for me, I can say, okay, cool. Now I'm going to give you full access. You can grab my documents. And to Dave's point, as soon as they don't need access, we're going to discontinue that.
That's awesome. Now we have a couple of questions in the comments. Do you guys have an app as well?
Yeah, great question. So Kamana is what's called a web app or progressive web app. So it's not something you download from the App Store, but when you sign up, you'll get an email with some instructions on how to do this, or we've got some instructions in our knowledge base, but you can save it to your home screen like an app. But really, we as a young company, we were really debating, do we build a native app? Do we build an Android app, an iOS app, a web app? Like, what direction do we take? And ultimately, from surveying the landscape of nurses and CNAs and respiratory therapists, like the status quo is I have some things on physical pieces of paper, and I have some things in my email inbox that came from the American Heart Association, and I have some things saved to my desktop that I maybe got a PDF image of 2 years ago, and we built it as a web app so that you can save it to your phone and interact with it like an app. But commonly when people are building their profile and sharing their profile, we see people even at the same time, like they've got their 4 pieces of paper and they're taking pictures of it right from inside the app. They're grabbing stuff from their computer at the same time. And the shorter answer is it is not a downloadable app from the App Store, but you can sign up and save it to your phone just like an app.
Mm-hmm. And it's super easy, and you can ask me for help if you do need help. And then, does Kamano work with CNAs too, or is it only for nurses?
Yeah, so it is for really all healthcare professionals that are needing to store and track and manage this stuff. So we tend to at the moment we don't serve most of the prescribing clinician levels, so physicians. The credentialing world is very different when you're a physician than it is than all of nursing and allied. So we do serve about 40 different professions, and we maintain in real time all the time a list of all those licenses and certifications, and even provide some resources on how do I go renew that license, or where do I go to renew it, or how much does it cost. So all of those managed and are more than welcome in the app.
And then can you walk us through sign up process up until completing your profile and stuff? Can you just walk us through that?
Yeah, sure. So you go to cavanaugh.com and you can create a profile, and from there you'll put in your login email address, your password, and you'll pick your profession, your specialty, years of experience. Like Dave said, it's nursing, and through our SLPs, our PTs, our OTs, our rad techs, any of you guys, more than welcome to create a profile. And then you're in your profile, and it's really your tool to do with it what you want. So when I talk to nurses that are using Kamana, some are like, look, this is just where I want to store this stuff and get reminders. So I don't want to build out my work history. Others are like, I need to create a resume. So they're coming in there and building out their work history. It's capturing all that, healthcare specific. What EHR did you use? Did you have charge experience? What was the patient ratio, et cetera? And they're generating a resume from that. So there's a workflow there to create that resume PDF. Other folks are using it to complete that entire profile and go through all of those things and upload those supporting documents for that PALS card, that TNCC card, that TB mask fit, that PPD, building out their work history. And really, it gives you the template to do all of the things that the recruiter, the compliance teams are going to ask for. And then when you can share that information with them, and it's with whoever you want. They don't have to be a customer of Kamana, because we have an ATS, an applicant tracking system, that we provide to staffing agencies where we generate revenue. So this whole piece here it's completely free for the traveling healthcare professional, but it's also free for that recruiter or that person up in HR and employee health. You're giving them access. You can turn it off at any time. They don't have to pay Kamana for that. So it's truly, at the end of the day, up to you how you want to use the tool, and it's there for you just to be better with your credentials and managing your relationships with recruiters.
Right on. That's awesome. And then do you guys have like a job platform or anything in terms of like trying to bridge like, oh yeah, I'm qualified for this with all my credentials and I want to apply for these jobs? Does that exist?
Yeah, so to talk a bit about the other side, so we talked a lot about how a healthcare professional can use this to store, track, manage, and share all their credentials. They can build their resume, they can export it if they want, but more importantly, they can share it with whoever they want. The other side of the platform, and I'll call out, like, this is how we make money. There's a staffing agency side of the platform where they use like the portal that we built for them to manage all of the information for travelers. So when a traveler goes on a contract, there are things that everyone here has been through onboarding and credentialing. There are things the staffing agency is required to maintain about you all to know that you are licensed, certified, and compliant to step foot into that facility. So we do have a large and growing customer base on the staffing agency side of the platform, and the healthcare professionals can use the platform or use their profile to apply and then just manage all the documents with one agency or 5 agencies or 10 agencies. As long as they're on the platform, like, that is the agency system of record. So I call that out to say we are in the process of, we'll call beta testing, but we've got hundreds of people using it every day. Like a Kamana job network is what we call it. So our staffing agencies are using the agency side of the platform, not just to manage the documentation and credentials and compliance for the healthcare pros, but they're also using it to advertise jobs and to know who's working what assignment on what day at what time. So we're starting to test bringing some of those jobs into what we call a Kamana job network, where people who come to the platform either independently or go join the Kamana job network by going to kamanahealth.com and joining the Kamana job network function can see jobs from the customers on the platform. There are a few dozen agencies on there now with jobs in all 50 states. And ultimately what that does is gives a place for folks with Kamana profiles to see jobs from multiple companies, multiple states, many facilities, click a button and say, I'm interested in that job. And what that does is it connects your profile with that agency, and then someone from that agency will reach out to see if you want to continue the conversation.
Okay, so it's not really a submittal. It's more of just like introducing and like connecting the two, and then you continue on the conversation.
Yeah, so we are not, and this is likely clear from the conversation so far, but I mean, we don't staff anybody. We're not a staff. Mm-hmm. We're simply there to actions, and ultimately, mm-hmm. the value in making the real value is like if you're a nurse and you see a really cool job in the ER on the Kamana job network and you've already got your profile completed, the status quo, right, is that you're going to have to fill out their application and send them all your documents and build a profile, and you got to go through all of these things. But with your Kamana profile, you can be submitted, 30 seconds after you've made that introduction.
Awesome. Cool. And then we got a question. Kelsey had created a Kamano account last year and actually never incorporated it to apply with a recruiter. How should she bridge this gap between a therapist and a recruiter?
Yeah, so I'll first say we operate in like true startup style, where if you signed up a year ago, we've probably done 30 product releases since then. The product probably looks very different than it did when you signed up, but ultimately, like the advice would be log into your profile, fill out that profile, use it to manage your resume, and throw away that Word document that you're managing. And when you're ready, that you can use the shares section of your account and just send your profile to them. And that way, when they come to you and say, hey, I need you to go to my website and update this and fill out that and all these things, you can just say, no, like I'm going to send you my Kamana profile link, and it has everything you need to know about me right there. And if there's something is missing, just tell me, I'll upload it and it'll be there instantaneously.
Okay, that's awesome. And so what's the future of Kamana? What are you guys envisioning?
Yeah, I mean, we still got a lot of work ahead of us with some of the we've got some other nurses on our team right now, and we're exploring like ways around tracking CEUs and kind of just bringing the entirety of our professional portfolio into one spot. So still some product and some features to build for healthcare professionals. And I'll note with that, like, we've got nurses on our team, we've got a physical therapist on our team, but we want to hear from other healthcare professionals. So I know I've picked Emily and Ryan's brain on different things that we're thinking about, but a lot of what we've done has been just from getting feedback from users. So reach out, let us know what that looks like. Like where does your life suck as a traveler? That's what we want to fix, so that we can all navigate this career a little bit better and it not be difficult. But yeah, the things that we're looking at is just how can we continue to support Kamana as that universal profile, that one profile that you're able to use. And there's healthcare professionals outside of the travel space that are struggling with this stuff too. So we're starting to have conversations with those nurses and those healthcare professionals that don't want to jump into the travel space quite yet. They're still needing to manage their stuff and share it with employee health, et cetera. So tons of opportunity in the space, and we're excited.
Awesome. And are you guys going to be at TravCon this year?
Yeah, great question. We will be at TravCon. We'll be doing it big. So funny enough, I guess, now 18 months ago, like TravCon 2019 was really our kind of coming out party. We had a while and had a few hundred people on the platform at the time. And, TravCon was really our big launch, and we were super bummed to miss it as everyone else was in 2020. And we'll be out there for 2021, and we've got some really exciting stuff going on at the conference, and are even doing some stuff before to do a giveaway to bring a traveler.
Exactly. So yeah, talk about the partnership that we have and what people can, how they can get to TravCon.
Yeah, for sure. So, I mean, first off, like what you all are doing at MedVenture, Emily and Ryan, it's so important. I mean, being a traveler, which I know I can't relate to myself, but I've had, conversations with so many folks that it sucks being on the road alone, and like being able to meet people and find out what to do in your city, and, hang out with other travelers and all that is great. So, we've obviously partnered with you all to get Kamana in front of your audience, which is super exciting to see how fast you all are growing. And from a giveaway perspective at TravCon, we have a giveaway going in partnership with MedVenture. So from the app, you can the MedVenture app, you can click a link in there, and there's a giveaway link, and you do a couple of fun things on Instagram and Twitter and social media, and signing up to create a Kamana profile. There's basically various ways that you can earn points through a couple different activities, both on social media and within the Kamana and MedVenture platforms. And we'll be giving away a pass to TravCon here at the end of the month. So pretty exciting.
Yeah. So you guys only have, what do we, like maybe 2 weeks left from the month ending. So make sure to click on the banners that we have on the app to enter. We really hope that a MedVenture user can win their spot to TravCon.
Yeah, we're definitely excited about the giveaway, and excited about the partnership with you all, excited about all the cool things. I know we spend a lot of time talking to travelers and to staffing agencies about all the things that they want and they need, and that suck about being a travel nurse. And we're working really hard to solve some of those things. And from a future Kamana perspective, things like onboarding and credentialing, and being able to see pay packages up front and being able to know what credentials are required to step foot in a hospital. I mean, these are all things we're working on bringing not just to our agency customers to for an agency to be able to tell you as a traveler, like, what do I need to onboard for this job? How much is the pay going to be? Like, so much back and forth, emailing and calling and texting, and we're working really hard to bring transparency into the process. And I digress a little bit into that from the conversation to say, as we roll into TribeCon in September, we'll have a lot of this stuff out the door, and we'll be really excited to meet all of you and get your feedback. John mentioned earlier, we're super feedback driven. We want to know, like, what do you like about Kamana? What do you hate about Kamana? What is awesome about your nurse? What sucks about your job as a nurse? Like, we want to hear all these things so that we bring some features and functionality, partner with great folks like MedVenture to make your life not just a little easier, but a lot easier as a traveler.
Yeah, I think what I love the most about you guys is that you guys are really you're prioritizing the clinicians, whereas I feel like most companies have really put us on the back burner and are just like using us, and it doesn't feel great, right? And I love that like transparency part, because that's definitely something we also adopt at MedVenture. We're like, you guys first, and then everything else falls out after that. So what is the best way to contact you guys for feedback?
Yeah, so you can check us out at cavanaugh.com, or you can email Dave or I at Dave at cavanaugh.com, or John at cavanaugh.com. But yeah, reach out.
Awesome.
We're generally accessible on any platform. If you like, add us on Twitter, or DM us on Instagram, or if you're in the app, there's a little contact us button. Any platform you can reach us through, one of us or a team member will respond pretty quickly.
Awesome. Well, any parting words for everybody? This was fantastic. I learned a lot. So thanks for being here.
We appreciate you, Emily, and we love what you all are doing. So keep up the good work there, and we'll keep doing what we're doing. At the end of the day, let's make it to where, as travel nurses, we can get out there. We don't get our information shared with other staffing agencies. We just create one profile. We use it where we want to use it, and really just kind of take control of our data and information. And yeah, we're excited about the work and super fun.
Awesome. Well, thank you both for your time. Really appreciate it.
Yeah, awesome. Thanks so much, Emily, and thanks, Ryan. I know you're back there somewhere, so we time and look forward to continue partnership with MedVenture and everything that lies ahead.
For sure. We'll see you guys at TravCon.
Yeah.
Cool. Later.
Bye. Thanks, everyone.